as much as you want to do manual treatment and massage and kind of work out those muscles, if you don't change your environment of stress, you're not going to change the feedback that's coming into the body.
Welcome back, everyone, to another episode from the Optimum Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking about costochondritis, which really just means rib pain or inflammation. And we're going to talk about what it is, what causes it, and really what you can do to help with that rib pain. So stay tuned. All right, so we're so excited to dive in on this one. We get so many questions about rib pain, what might be causing it, and what I can do about it. But before we hop in, why don't you comment below? Do you have rib pain? Have you experienced anything like this before? Please consider hitting the subscribe button and notification bell so that you can continue to stay up to date on new podcasts that we have go live on the YouTube channel. And when DocJen over here does her mobility videos and pain specific videos that you would really find beneficial for your body. All right, let's dive into rib pain.
So we're talking about costochondritis, which if you're not as familiar with it, it is like inflammation around the cartilage that connects our ribs together and even our sternum. So you might get pain like around that sternum or that breastplate area between the ribs. It might hurt with like deep breath, stuff like that. We're going to talk about what really kind of causes costochondritis and what you can start to do to either relieve that pain and hopefully prevent that pain.
And we also did a podcast on slipping rib syndrome that was all the way back on episode 84. Episode 84 got a little mixed up with my numbers. So if you want to go check that out, also if you're watching YouTube, we'll try and tag it somewhere up here. And that is going to have some similar things because costochondritis isn't necessarily slipping rib syndrome. They're not necessarily equal, but they might have similar symptoms or presentations as well as what we're going to do. Yeah, as well as what we're going to do to help out with them.
Thinking of like, well, where does this come from? And honestly, a lot of the causes are unknown, but unfortunately it's higher in females and it is higher once you get over the age of 40.
The rib cage is this structure that was created to protect all of these vital organs that we hold in here, like our heart, our lungs, our liver. So inherently it's a really stable structure, which is great for a lot of reasons, but also there are so many vessels and nerves that run right along the inside or in between those ribs. So when that structure is so stable, if we ever get lack of mobility or what mobility we might have in that rib cage, it can start to irritate some of those different nerves or occlude different vessels from being able to run smoothly through certain spaces. And that's what can start to irritate the nerves and then therefore irritate this cartilage. There are other different things that contribute like traumas. So if you have trauma to the chest wall, if you've gotten in a car accident and the seatbelt yanks really hard at you, those are different things that might irritate certain rib segments.
And they even say like even a tight hug can sometimes irritate a lot of people. And that could be, you know, a little bit more psychosomatic that you're kind of dealing with, a little bit more maybe emotional trauma associated with this pain and somatic experience. That it could even be a tight bra that a lot of people complain of, the underwire, like that is
digging into a certain area.
And like continuous pressure in an area that can start to cause maybe some irritation. However, again, there's no one direct reason someone might develop it, and it can last, you know, anywhere from weeks to months, and then sometimes it's recurring.
And so what we'll notice is that movement or exercise related things that can be associated with this are anything repetitive, things that are overhead, things that cause us to use a lot of our chest, neck, upper shoulder muscles that all tend to attach right into that rib cage. And if we're doing repetitive things, those muscles might be pulling on a specific rib segment more than others and start to cause some of that irritation.
Or say you've done something that's a little bit out of the norm. So you're lifting something heavy, you're moving. All of a sudden you're using like a lot of that upper body strain and stress on your body that you're not typically used to. Or you could be sick and that's lasting like a really long time, and you're repetitively coughing and kind of using those muscles, because every time we cough, we kind of bear down and we contract around the muscles around the rib cage. So that repetitive coughing, those really deep breaths that can cause some repetitive irritation that's happening around the area.
Same with laughing and sneezing. So don't go to like 4 comedy shows in a row. Otherwise, you might get costochondritis.
Right.
As we talk about with many of these pain disorders, once our system gets into that hyperexcitable state, the first trick and the first challenge is getting it to calm down. And how do we start to get that nerve to calm down so that we don't have as much pain?
If something has elicited that pain symptom, but now we're in a stressful environment, we're not sleeping as much, or we're getting chewed out by the boss, or there's just so much going on at home that's really overwhelming, or you're in a fight with a really good friend, like what could be happening that could be eliciting that stress response and keeping you in that heightened state. And so now our body's a little bit more sensitive when we feel that pain come on, when we feel those symptoms. It's just too overwhelming. Our cup is overflowing, our brain doesn't know what to do, and it's just going to continue to put in those pain signals. So now anytime we do go open a door, or we do go bend over or laugh, we start
get that tight hug.
Yeah, we feel those symptoms even more. And so we're going to talk about the exercises that you can do. Of course, we always do, right? But we have to be cognizant and aware of the greater environment. And for some people, you might say, I'm not stressed, like everything's going fine. But what if you just journaled it or like wrote down your day to day? Take a look at the inventory of your life just to see what could be adding in, or maybe you're getting a tracker to track how much you're sleeping or how well you're sleeping. Like getting some feedback is really important, as well as these exercises we're going to talk about. As much as you want to do manual treatment and massage and kind of work out those muscles, if you don't change your environment of stress, you're not going to change the feedback that's coming into the body. Mm-hmm. All of those measures of manual treatment, of things to stretch and massage and relax those tissues, are only going to last temporarily. And I think that's what's so incredibly important. I get DMs all the time while I'm doing massage and I'm seeing my chiropractor and I'm doing all these passive treatments. But are you taking inventory on what you're doing on a day-to-day or how your environment is affecting you? And one of the first things that I like to start people off with is going in front of a mirror and just taking some deep, slow, long breaths, which you think is going to be relaxing. And take a look. Do your shoulders raise? Does your neck tense? That's a huge one. I've been on calls with people, even just virtually, and the neck is the one thing that's firing up every single time they're trying to take a relaxing breath. So just starting to get familiar, what is my natural pattern, so that we can start to rewire a new pattern.
It's not that you shouldn't get massage or have anything else that's passive that is being done to you, but it's adding in these things that are going to help you create a new normal and a new environment in your system. Just to start off with, of course, when we're looking at treatment, we want to start to become more aware of or remove some of the things that were irritating in the first place. Yeah. Swinging the tennis racket is something that you think started the irritation and is now very irritating to do. You might need to take a break from tennis or pickleball, because pickleball is all the rage these days.
We can also just start with walking or some gentle swimming in a pool and really starting to get heat on the body. So that's going to start to help to increase that blood flow and down-regulate the system, kind of help us relax a little bit more.
Yeah, and as we know from the podcast we did on heat treatments and heat therapies, heat just has this calming effect. It's going to help our brain release more of those endorphins, and it has a gating, so a pain gating effect, where our body and our brain feels the heat and that soothing before the pain signals get to our brain. So it's going to just help calm all that down anyway.
Yeah. So let's talk about some of the stretches that we love. So when we're talking about tight pecs, traditionally it's the doorway one, where if you have limitation in your shoulder external rotation, that is a really hard stretch for a lot of people. So I actually don't prefer that one. I think you have to really mix it up and find a different place for your arms, but I think an even more relaxing one that I go to time and time again is the wall pec stretch. But really, we're just thinking of opening up. We kind of get a little bit of thoracic upper back mobility, which is typically lacking in those who have costochondritis. And what you're really focusing on, rather than just the pec stretch, but you're focusing on the deep breathing and the relaxing breathing. And what I like to do when I do that, the arm that's stretching, the opposite arm, I wrap my hand around my low rib cage and I try to feel that low rib cage move. So I try to put the breath into my hand on that side that I'm stretching so that I can start to expand that rib cage, get that mobility back in that rib cage, and get that system to down regulate as I'm opening up the front of that chest.
Yeah, and then after that, continuing with kind of this down regulation and finding ways to get breath, especially breath to expand the rib cage, get into a child's pose. And again, if child's pose is difficult to get into because of your knee mobility or your hip mobility, you can always elevate your hands on a surface or sit with a little pillow kind of in the crook of your knee to help with any knee discomfort. But getting into child's pose and sitting back and then just taking 3 to 4 deep breaths kind of in the back of that rib cage. So feeling the breath expand into the back of your rib cage, and then relaxing, and then moving from a straight ahead child's pose to kind of a lateral child's pose. So you reach your arm across, and then you're going to feel that stretch all the way through your lat, which again kind of connects down into the back of your rib cage and will also help you breathe into the side of that rib cage. So through all of these stretches, that's going to be one thread that's going to remain, is the breath.
Yeah. So you don't need to take these huge deep breaths if that's eliciting your pain. We're not saying to breathe into pain. We're saying we want to start to move that rib cage. So even if that's a little inhale, like a 1 to 2 second inhale, and then a really long exhale. Again, you don't have to do this deep breathing that is like really trying to get this huge expansion. It could be 1 to 2 second, maybe you hold your breath a little bit and then do a 3 to 4 second exhale.
Here's where one of the tools that we love to use comes in. It's the Courgeous ball. It's kind of a medium-ish size ball that has a little bit of deflation to it, and it's got a great grippiness to it. So we recommend doing this without a shirt on or with a sports bra on. And you can start on your stomach, where that ball is just kind of on the low part of your rib cage, and you're laying and allowing yourself to breathe and trying to press those ribs out into that ball. And after a few of those breaths, you can move to the side. Again, try and breathe down into that side of that rib cage, into that ball. Do it on the other side. And then you can lay with the ball right on your back, kind of in the middle of your thoracic spine, or kind of even with your chest. And you almost just rotate on it. And what that's going to do is it's going to grip the skin and kind of put this little bit of a torque into the skin, and it's really going to start to give some input to the fascia that's right underneath the skin.
As you're laying on the ball, you kind of do a little inhale, again, to what's tolerable for you, and then you contract the body. So you kind of like, you're thinking of pulling the rib cage and the stomach away from the ball as much as you can as you're holding that breath in, and then you let everything out and you try to melt over that ball as much as possible. You could do that on your stomach, you could do that on the side of the ribs, and all that's doing is we're trying to create that feedback for the brain to say you can relax.
So how can we insert throughout our day a few pauses where we consciously take 2 or 3 breaths, put our hands on our low rib cage, press into it a little bit, and breathe into that low rib cage, breathe away, feel that rib cage contract down. Even if you do 3 or 4 of those every hour or 2 throughout the day, that's going to go a long way over the course of a few weeks to helping that reprogramming.
So if we take a breath in and reach down and kind of round through the back and try to breathe in and expand from the back of that rib cage, and then breathe out and open up the chest and try to extend in that back as much as you can. And even if you were to do this flexion and extension of the upper back numerous times throughout the day, especially if you work at a desk, oh my goodness, just imagine how much better you'll feel rather than being in a stagnant position, but actually getting some mobilization and some movement from that upper back. It would just start to feel so much better.
You can literally do it while you're waiting for a meeting to start, while you're waiting for a page to load, while you're waiting on hold for some sort of call, like anything. There's no excuse that you can't find 10 seconds to do a few of these breaths, a couple times throughout the day. It really doesn't take much extra time. You just have to be creative in where you find that time. And so then the last one, again, we're going to bring another tool. You can use a foam roller and kind of laying on that lengthwise, right?
So
it's
a long
kind
foam roller
running from your tailbone up to your head. And this is where we love to just use this to get an opening of the chest and the pec area. You can even just start by letting those arms relax down to the side, and then get back into that breathing where you're going to be trying to take a deep breath into that low rib cage. And then as you exhale and you pull that rib cage down, you're probably going to feel that stretch deepen in itself because you're changing the position of the rib cage, where those pec muscles attach into.
But anything that starts to relax the chest, relax the neck, relax the lats, get the neck moving a little bit more, the upper back moving a little bit more, we're going to start to reduce those symptoms and those pain signals that are eliciting that inflammation response. It's not literally that you're looking inflamed around the rib cage. It's that we have this continuous chronic inflammation response kind of happening around this rib cage, and it's eliciting this pain. So what we need to do is get our bodies moving, get our bodies feeling better, and we can start to change those signals that are happening. Thanks so much for joining us on another episode. I hope that you enjoyed this one. And even if you don't have costochondritis, I don't want you to get it. So comment below, let us know what exercises you're going to start implementing into your day now, because at least a few of them everyone can start to do. And we'll drop the link for the Coregeous Ball, for Brentwood Home, because we kind of touched on a few of those tools. So we'll drop the links for all those tools that you can use below. So definitely check them out. And don't forget to please subscribe so you don't miss out on any future podcasts or just YouTube videos in general, where we'll go over the body and help you feel free.